Let's bring in senior national policy reporter Ann Flaherty and ABC News medical contributor Dr. Alok Patel for more on this. Dr. Patel, some major cities are now strongly recommending that people wear masks indoors to help, slow the spread of COVID. Cases of the flu are also on the rise. What's your take on this? Because some people are saying, oh, God, no, not back to the masks. Is this necessary?
I think it's absolutely something people should consider, especially if you yourself are high risk or you live with someone who is right now, Diane, because we're seeing that the rates of all respiratory viruses are on the rise. But also, if you look at the actual vaccine uptake rate among the elderly right now who comprise the highest amount of COVID-19 deaths, it's low. According to the Centers for Medicare and Medicaid Services, about half of nursing home recipients are up to date on their COVID vaccine. So consider people around you. And remember that masking, if you're symptomatic, prevents spread and can actually help people around you. Just take everyone into account this holiday season.
Now, and with the rise in not only COVID, but also RSV and flu, could masking become federal policy again?
So, no, I don't think so. I would be very, very surprised, Diane, if we saw any kind of federal policy towards masking. What we saw earlier this year was the CDC moving away from that. They established these community-level guidelines. So if you Google that, COVID community levels, you can go online and figure out whether or not the levels in your local community are high enough that you should be wearing a mask. They want to make these decisions at the local level, not at the federal level, and they've been very clear on that.
And is it possible that we could see those guidelines start to change a bit and incorporate RSV and flu, since this is being called the quote-unquote tripledemic?
Well, I think at this point the CDC is turning to local public health officials to make those decisions and to try to put out those numbers. The CDC, as amazing as it is, there still isn't a lot of ability to track all of these viruses at this granular level. So, really turning to those local health departments to figure out what you need in that area.
So, Dr. Patel, it's the holidays. People are getting together with family and friends. So how do you do that and still stay safe, particularly if you do have someone more vulnerable in your family?
Absolutely. And, some of the similar things that we've been talking about the last couple holiday seasons still apply in terms of asking people if they're actually feeling sick, asking guests as hard as it is to stay home if they're feeling symptomatic. Masks still work if you have those higher risk guests, making sure people are vaccinated. Testing is still a thing. Diane, we're seeing this surge right now, but this is the rest of our lives, as far as we know, with respiratory viruses. So the question now is, do we have the actual mitigation strategies to take the brunt of what's happening every cold and flu season? We have to have those honest conversations.
And it is still hard to get cold and flu drugs in certain areas of the country as well. So what's the latest on that?
So what we're hearing about, Diane, are these local temporary shortages. And of course, very frustrating to parents that go to their local store and find that a certain cold medicine that they like is out. What we're hearing from manufacturers is that there's no shortage per se. It's just a distribution problem. So it's very hard to predict where these medicines should go, depending on, upticks in flu or COVID. So they say that just keep checking back, keep calling around. There is enough medicine. It's just a question of getting it where it needs to be, Diane.
And Dr. Patel, if you are one of those more vulnerable people, or you just want to have, take less risk than maybe other people in your immediate circle, if you wear a mask, how much does that protect you?
I think it's more important that you're wearing a mask, but you also are up to date on your vaccines as well. And if you're wearing a mask, you are going to have a certain level of protection, but the people around you are also going to be dictating how safe you really are. That's why these honest conversations amongst friends and family are really important right now, not only during this holiday season, but during any time we see these rise in surges. And Diane, you can ask the millions of Americans who are immunocompromised what they do on a daily basis. This is their reality.
All right, Dr. Patel and Flaherty, thank you both.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.